Hello, my name is Dr. Jessica Leung, and I am a radiologist specializing in breast imaging from Houston, Texas, in the United States. I'm here at the BGICC conference, learning a lot from all my colleagues, networking, acquiring the latest technology, and the frontiers for breast cancer care. One of the topics of interest to all of us is the management of lymph nodes in breast cancer patient. Of course, a very, very key and very significant a consideration in the care of any breast cancer patients. That is one of the most important prognostic indicators as well as a variable for guiding treatment. I, as a radiologist, believe that imaging has a very significant role in caring for breast cancer patients in this way. We performed imaging, particularly ultrasound, followed by MRI, in assessing the patient preoperatively, so then we can provide our clinical colleagues, in particular our surgeons, with a good sense of the nodal burden in any breast cancer patients. With ultrasound and MRI, we can evaluate lymph nodes not just in the breast, but also in the regional nodal basins, in particular the axilla, the internal mammary chain, as well as higher up in the low neck, the supraclavicular region. So all the regional nodal basins that matter in terms of the T and M nodal staging. Again, that guides treatment and that gives prognosis to the newly diagnosed breast cancer patient. Now, ultrasound is our best and most most accessible test, if you will. And ultrasound also has the amazing capability of guiding the needle so that biopsies can be performed for tissue diagnosis. Biopsies are either done by fine needle aspiration biopsy, which is what is commonly done for the lymph nodes, along with core biopsies. Of course, MRI has the ability to give an overall look, both sides, so you can look for symmetry or versus asymmetry to determine if something is abnormal. One thing about MRI is that it is relatively expensive compared to ultrasound. So ultrasound may be the first test of choice. Now, you have additional cross-sectional imaging like PET-CT, for example, that will give you an overall look at the body, and that will also look at the functional aspects of metabolic uptake. And that's another exciting thing to determine whether a lymph node is involved by tumor. Bottom line is that with various kinds of imaging these days, we can look at both the number and the location of abnormal nodes that could represent cancer. And then we have modern biopsy techniques that can help us determine with certainty through tissue diagnosis. And all that information is put together along with our clinical colleagues' management decisions to determine how to proceed best. Hopefully, in the near future, we can have vascular-based precision imaging so that we're very specific for tumor cells, perhaps obviating the need for tissue diagnosis for the biopsy. And that would be an amazing thing because then it will be non-invasive completely. Okay. And of course, even before that is achieved, we currently have advanced technologies such that our imaging is better and better, higher resolution, so that we're more accurate. And so we have higher sensitivity and higher specificity at the same time. Now, this conference allows us to network and to learn from colleagues around the world. And the world is a big place. And even just my home country, the United States, is a big place. And there are varying practices across different institutions. And of course, suffice it to say that it is an amazing opportunity to learn from each other, what works, what doesn't, why certain things work at one institution and may not another. And overall, though, to have some sort of unified policy or approach for our patients that maximizes both, of course, the clinical outcome and cost effectiveness so that great care can be delivered to all our patients around the world. So BGICC, exciting, happy to be here this year and look forward to future years in terms of international and multidisciplinary collaboration. Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.